National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at nationalnutrition.ca. Today we're going to tackle the large topic of men's health. We're going to talk about the subtle differences between men and women that men have to be a little bit more concerned about because they're either at higher risk of a disease or it's a disease of an organ that you only find in men. So the obvious one that comes to mind that most men have to worry about is their prostate. Prostate cancer essentially will develop in any man if they live long enough. Now, there are lifestyle things though that you can do to reduce any chance of prostate cancer development at all in your life, or reduce the chance of developing another prostate condition known as benign prostatic hyperplasia. In both prostate cancer and BPH as it's known, you do get overgrowth of the prostate. It's just a slightly different mechanism behind both, although both do seem to be affected by something called dihydrotestosterone as well as your estrogen. And in fact, recent research is even suggesting that estrogen has a much larger impact on BPH than does your DHT or dihydrotestosterone. I mean, both are associated with increased prostate volume. And what ends up happening with that is it essentially pinches off the urethra. It decreases urine flow. It can lead to a lot of urinary frequency, some urgency in what we call stopping and starting, or sometimes even taking a long time to get started for urination. All of those can be signs of benign prostatic hyperplasia, or in some cases prostate cancer. So if you do have any of those symptoms, it's best to get checked out to see exactly which one's going to be the cause. And if it's something like BPH, there's a lot of natural therapies that you can use to help manage that. The biggest one that comes to mind is saw palmetto. It's been very, very well studied to help reduce symptoms of BPH and actually reduce prostate volume. So it actually helps shrink it back to the normal size, and that's why it gets rid of the symptoms. Saw palmetto, very, very effective, very safe to use. And again, like I said, it'll actually shrink your prostate back down to the original size, and it does that over time. So that's something that can be used. Zinc, again, zinc deficiencies are heavily associated with BPH problems, and men do have higher zinc requirements than women, yet they often don't pay attention to that, and they don't eat foods that are either very high in zinc. Things like certain types of shellfish and certain types of nuts are higher in zinc, and that's very, very important for maintaining a healthy prostate. Now, in addition to prostate problems, other things men often worry about are heart disease, increased risk of atherosclerosis or hardening of the arteries, and with this often comes high blood pressure. So some of the things you can do to really help maintain your arterial health, things like supplementing with coenzyme Q10 to just improve the efficiency of the cardiovascular system, and that helps reduce the pressure needed for oxygen delivery, and that can help reduce, again, that hypertension. As well, supplementing with things like collagen to help maintain the elasticity of the arteries can be very, very, very effective. And then lastly, the other thing that men often worry about is the function of their member. We're talking about erectile dysfunction. And so when sexual function goes down in a man over time, there's usually a number of reasons. Medications, smoking, stress, low testosterone, and decreases in blood flow are all major causes. As well, another major cause is that benign prostatic hyperplasia. So if you have that, you may actually notice some erectile dysfunction with it. So depending on the cause, obviously if it's medication induced, speak with your doctor about possibly changing medications or things you can do to help manage that side effect. As well, if it's something like smoking, well, the obvious, quit smoking. But if it's something like stress or low testosterone, there are a few things you can do to help manage that. And again, often with high stress comes low testosterone as the body overconverts testosterone into estrogen when it's in certain stressful scenarios. So managing that stress can be the key to getting that testosterone level back to where it should be. And so things that you can do to manage stress, use of adrenal supplements, certain herbs such as ashwagandha has been shown to help lower cortisol levels. Things like rhodiola have been shown to help lower cortisol levels, and that's a sign of improved stress response. And then as well, things like Tribulus terrestris. It's a herb that's been shown to increase your sensitivity to testosterone So if you have low levels, it's like, how do you do more with the little that you have? And then lastly, one of my favorite herbs on this topic, it's called Uricomia longifolia jack, also known as Tongat Ali. And this herb has actually been shown to help raise free testosterone levels. So very, very important herb for managing erectile dysfunction. So if you have any of these men's health problems, I hope this video has helped you out. Please share it with the men in your life. Sign up to our YouTube channel to subscribe. If you have any questions or comments, post them below. And last but not least, always remember, knowledge is health.